The burden of disease is the years of life lost due to premature mortality and health problems. It is measured in terms of disability-adjusted life years and is classified into three groups. The first group consists of communicable conditions and accounts for more than 41,000 years lost. The two main factors are neonatal conditions and infectious disease. Non-communicable diseases account for 34,000 years lost, and the third group, which is injuries, accounts for about 9,000. Based on these statistics, Pakistan is high in both communicable and non-communicable diseases and holds a double burden of disease. The top causes of death in Pakistan are heart disease, stroke, pneumonia for adults, and accounts for 28% of all deaths in 2013. Heart diseases alone took over 40,000 lives. Newborn death was the top cause of child mortality in Pakistan, and over half the deaths of children occurred within their first month. As of 2015, the under 5 mortality rate was 81 per 1,000 births. In 2013, 17.1% of child mortality deaths were caused by acute lower respiratory infections, 19% due to prematurity, and 12.7% due to birth asphyxia and trauma.
The World Health Organization lists Pakistan as one of the 57 countries in the world facing a crisis in the shortage of healthcare workers. The shortage is particularly evident in rural areas of the country. There is a noteworthy gap between the showing of health professional training institutions and the actual number of health professionals taken by the health sector in Pakistan. One particular study found that Pakistan contributed about 13,000 medical graduates to the United States, United Kingdom, Canada, and Australia. A lady health worker program was launched by the government to support rural areas along with the urban slums of the country in 1994. It supports health promotion by providing basic health care. A study in 2000 found that the portion of Pakistan that was assisted by the lady health workers had remarkably better health indicators than the overall population. An expansion and continuation of the lady health workers program would be a great step forward for Pakistan. Increasing communication between the different levels of government would help with any medicine supply issues. Allowing the lady health workers the opportunity to further develop their education through the program using government spending would greatly help push integration of the program into other regions of Pakistan. The more efficient way of using the country's human and financial resources would be to task shift towards the lady health worker program and to reorganize the healthcare system in the country.
Overall, Pakistan seems to be lacking in comparison to the regional values in regard to the general health and population indicators, which can be attributed to insufficient education. Unfortunately, Pakistan did not reach the Millennium Development Goal and are currently sitting at a consistent 58% for literacy rates. Males' literacy rates sit at 79.1% compared to females at 61.5%, with only 29.2% of females going on to secondary school. Uneducated women specifically are unaware of proper household cooking techniques, the importance of clean water, hygiene, contraceptives, and proper child nutrition. Without literacy, people are not able to read packages for safe use, may not understand public health announcements, and may practice unsafe hygienic behaviors. Improving Pakistan's education will pave the way for a flourishing economy, low fertility and mortality rates, and a high standard of living. The government should ensure that there are enough schools in close proximity to rural areas and maintain the well-being of current schools efficiently. Roads and public transit systems must be improved to ensure children are able to make it to school. Fees should be reduced and funds should be allocated accordingly. Attendance should be compulsory and staff must follow the correct curriculum. The cultural stigma around females must be diminished and the government must address families to convince of the benefits of their child's education. A campaign concerning contraceptive measures and basic hygiene should also be enforced, with a heavy distribution of condoms and birth control. The government must encourage sanitation and educate the public about such procedures, including hand washing and vaccinations.
Pakistan's burden of disease is largely made up of communicable diseases, and infectious diseases can be caused by contaminated water sources. Diarrhea is an example of a disease directly related to water quality. It is a major contributor to high child mortality rates, and it can cause other conditions such as malnutrition and acute respiratory illness, which is responsible for over 17% of deaths in children under 5. This is one of the many reasons why water quality is a main health concern for Pakistan. Because of a shortage of water, people must resort to using whatever water sources are available, unaware of the potential dangers attributed to poor water sanitation. Better sanitation procedures should be used to avoid further water contamination, resulting in safer drinking water that will help reduce the burden of disease. Also, currently only 9% of the water supply is kept in reservoirs. By using more reservoirs to store water, the negative effects of the water shortage will be resolved.